Morning, class. We are on chapter 24. This is WEAB, Water Electrolyte Acid Base Balance. Cellular function requires a fluid medium which is carefully controlled in composition. So the balance should be homeostatically in place. Fluid, electrolyte, acid base balance. Now, this is maintained by many organ systems. You have the urinary, respiratory, digestive, the skin, integumentary, the endocrine, the nervous, cardiovascular, and lymphatic systems, because this balances, if not kept in place, will result in a disease process. So it's very important that we keep this balance. From this part of the lecture, we need to, our goal is to know the major fluid compartments, how they move water from one place to the other, the body's source of water, how it loses water, mechanism of water intake and output, conditions in which the body has a deficiency or too much or excess, and our improper distribution of water among the compartments. A newborn's baby's body weight is about 75% water, a lot about water. Average 55 to 60% water is in young men. Women have less slightly. Obese and elderly people have about 45% by weight. TBW is total body water, about 40 L or liters in a 70 kilogram, 150 pound individual. This is very important to remember. In water balance, and we'll talk about water balance first, there's ICF and ECF, where ICF is intracellular fluid and ECF is extracellular fluid. But take note, there is more ICF, 65%, than ECF in our body. All right, there's more inside fluid, inside the cell fluid. Now, out of the 35%, 25 is found along or around the cells. We call it interstitial fluid. 8% is found as in the blood plasma and that's in the lymphatics. 2% is transcellular fluid or catch-all, which includes CSF, synovial between the joints, peritoneum in the abdomen, pleura in the thoracic, pericardial in the heart, vitreous and aqueous humor of the eye, right? The fluid in the eye, bile, fluids of the digestive, urinary and reproductive tracts. These are the only 2%. And we always talk about this. Imagine that's only 2% of an actual 35% ECF. Right? So take a note of that. Fluid continuously exchanges between the compartments, and fluid or water moves from where there's high amount to where it's lower in amount. Right? It's attracted to go towards a lower level or amount, and you call that osmosis. If imbalances arises, osmosis restores the balance, and the intercellular and extracellular osmolarity are equal. Right? If the osmolarity of the tissue fluid increases, water moves out of the cell and try to satisfy where there's less water. If it falls, the inside of the cell decreases, water will move in. So it always, where water always tries to balance itself. Now the electrolytes, the sodium salts in the ECF, the potassium salts, play a major factor on the balance. Electrolytes play the principal role in governing the body's water distribution and water content. So basically, this is the fluid inside the cells. These are cells, huh? Okay, and assuming they have good amount of fluid. This bluish area is the extracellular fluid. We also call them interstitial fluid, huh? Interstitial fluid. Now, this is water coming in, and there's also metabolic water that's also added to the circulatory system. And then there's also water that's coming from the lymphatic, which is brought back to the circulatory system, which will bring water in or out depending on the level of water we have in the cells. Huh? And again, water will move from one space to the other depending on where it is less. Gain and loss is usually running equal. Just keep in mind from the gains, there's also metabolic water coming from metabolism. And there's also water from food and drink. Huh? There's water that's lost in the urine, the feces, and sweat. And there's also, those are sensible water loss. And there's insensible where you can't actually control it. Expired breath, cutaneous transpiration, right? Depending on how much you are in your temperature level. There's also water that has to be taken out. For example, through your air, expired air, skin, all the way to the minimum urine output. So if you think about it, you gain water from metabolic water, food, and drink, but you also lose them through urine, cutaneous transpiration, feces. Overall, they pretty much balance themselves. They pretty much balance themselves. The thirst is depending on the fluid intake. Huh? Dehydration reduces blood volume and pressure, and therefore, if you take out the fluid part of that, you will end up being very concentrated, and your blood osmolarity increases. Now, when your blood is high in osmolarity, very concentrated, this will trigger receptors in your brain, huh? Specifically in the hypothalamus. Receptors respond to angiotensin 2, especially when the pressure goes down, and of course the concentration goes up. The receptors communicate with other hypothalamic neurons and actually make you go for water. It also produces antidiuretic hormone, or what we call your ADH, antidiuretic hormone. Huh? Because of this, it will stop you losing water so you can conserve it. And again, like I said, the cerebral cortex will produce sensation of thirst, which will make you go for water. Salivation is inhibited with thirst because it's trying to connect it with a sympathetic drive to the salivary glands, which is usually thick fluid or thick saliva, not thin. Now, when you drink water, you satisfy the feeling and sensation of water coming in, and also the increase in stretch as you are trying to fill your stomach with water. This is more of what your brain decided to do, right? Again, the short-term inhibition is the actual sensation, while the actual feeling of water filling the stomach is the long-term inhibition. Huh? Dehydration happens, but when dehydration happens, you have two pathways that would increase you for the sense of thirst. One is because of increased concentration or increased blood osmolarity. This will trigger hypothalamic responses and make you go and sense the sense of thirst. So this is about concentration. One is about the volume that is lost. Decreased blood pressure because of loss of water will trigger the angiotensin 2 or the RAAM that we learned in chapter 23, renin angiotensin aldosterone mechanism. It will also lead to the sense of thirst. And when the sense of thirst kicks in, you will ingest water, right? The physical effect of water in us, the effect that it fills the blood, rehydrating it, and the physical distension of the stomach all completes and fulfills the need for having water, right? And therefore, hopefully, fulfills dehydration. Now, the balance usually is kept by the kidney. Kidney does not replace the water or electrolytes, it just balances it. So, any loss, we keep water. Any excess, we let the water be taken out by the kidney. Mechanisms of water output include antidiuretic hormone, which makes aquaporins. These are passageway membrane proteins that help bring back water in. Now, antidiuretic hormone is active when you have high osmolarity. When the osmolarity decreases, antidiuretic hormone ceases its function. Don't forget that there is a condition where you have low ADH, and that is your diabetes insipidus. Okay, here it shows also how the blood pressure increase or the blood osmolarity increases, stimulating hypothalamic receptors, which leads to increase in water reabsorption and therefore reducing the urine output because you try to reabsorb it. As this is pulled in, you are slowly increasing water, right? And by increasing water, you fulfill the dehydration need. Once this is filled up, there would be a negative feedback loop that would stop it so you don't increase the pressure at that point. We don't want to have blood pressure increase also. The body is in a state of fluid imbalance if there is abnormal in the total volume, concentration, and distribution. And if there's too much this or imbalance, you can have circulatory shock when you have lack of volume. Now, neurologic dysfunction can also happen, especially when the cells have already been being affected. Diarrhea is a very dangerous condition that can lead to loss of fluid, even especially in children. Deficiency happen as a volume deficiency or depletion or dehydration. In depletion, equal amounts of water and sodium are lost. So the total body water declines, but the osmolarity or the concentration is the same. So especially, for example, in bleeding, where you lose the same amount of fluid and formed elements. I mean, when I say fluid, meaning plasma. If it's equal in the loss, this is volume depletion. But in dehydration, you usually lose the fluid only and you keep the formed elements. So in this case, the concentration will rise. We mentioned diabetes insipidus earlier. Also mentioned that infants are more prone to severe dehydration because of their high metabolic rate. All right. And when this happens, water will have to be borrowed from one place to the other, and therefore ICF, blood, and tissue fluid are all affected. When you have excessive sweating, water is also lost. Water or sweat is produced by capillary filtration. The blood volume and pressure will drop, and your concentration or osmolarity will be going up. Blood will absorb tissue fluid to replace the loss, and tissue fluid will pull from intercellular fluid. When intercellular fluid is affected, then you have nerve cells or inside organ cells being affected, and their function will get diminished. For 1 liter of sweat, you can lose 300 ml from tissue fluid and 700 ml from ICF. So visually, if there's too much heat on the skin, this will make the water evaporate. And because water evaporated, your osmolarity will be high in this level of the skin, and it will try to pull now from water that's beneath it. And when that water is also pulled by the skin by osmosis, then you will also lose that water if this individual is still exposed to the heat. In fact, from there, this level will then have to borrow from uh, the vascular system. Well, the vascular system picks up from not only in this area, but also from inside organs, right? So that may give a good amount of relief. But if the individual is still exposed to the heat, we will continue to lose water by evaporation. And if this circulatory system starts to get depleted, guess what? It will start to affect the fluid between cells, not yet the cells. Huh? The interstitial fluid will be the next compartment that will enhance water to go from that compartment into the circulatory system, which has turned osmotically high because it lost fluid. So this is another high source of water, which will temporarily quench the thirst for fluid, for in the circulatory system. And then again, from the circulatory system, it goes to the skin, and the skin eventually loses it because of the exposed heat. Finally, if the interstitial fluid becomes depleted, there would be an area of less water. So now the inside of the cells is the area with more water, and it will now attract the water from inside the cells to go out to dehydrate the cells. And when that happens, you have an extreme level of dehydration that can lead to fatal situations, right? Huh? So that's how the fluid is transferred from one compartment to the other. If the ongoing situation persists, which is the heat where this body is exposed to. Now, in cold weather, the skin is constricted, and when I mean, the blood vessels in the skin is constricted. If you constrict that, we always say the peripheral vessels, the smaller vessels, when they constrict, they will raise the blood pressure. When they dilate, they will bring down the blood pressure. So if they constricted, the blood pressure will increase, and therefore it will start to increase pressure within the system. The heart will experience the pressure, and it will release ANP, atrial natriuretic peptide. Atrial natriuretic peptide will work on the distal convoluted tubules of the kidney, which would make them release fluid. Well, first of all, release sodium. And sodium is followed by water, and therefore it lets water out. Sodium in water is lost, pressure goes down, but you actually lose the volume at this point. Huh? So with that, your urine output is increased, but the blood volume is reduced. And that's basically what you remember if it's in a cold area. You tend to go potty a lot. Cold air is drier and increases respiratory water loss, uh, also reducing blood volume because it by itself is thin air, also, especially in a high place, and there's less water because it's drier. Okay, so exercise dilates vessels in the skeletal muscle. Insufficient blood for the rest of the body can bring on weakness and early fatigue. Huh? Fluid excess, on the other hand, let's talk about fluid excess. We've been talking about dehydration. How about if there's too much fluid? Well, the kidney will compensate by releasing fluid that is excess. Huh? Now, if the kidney is failing, then uh, fluid can be retained and fluid will not go out. That's what you see when people with edema shows their situation, or people with they get swollen up even on the face. Huh? Children who have post-streptococcal glomerulonephritis, when the kidney is affected, will end up with swelling faces because of the increased retention of water because the kidney failed to release them. So this is a comparison of blood volume with the fluid intake per day. So this is from 1 liter, 2, 3, 4 liters. Huh? If a person is taking in about a couple of 1.5 to 3 liters, then your volume is at about at 5, which is a safe and normal volume. Now, if the person is not taking in any fluid, you will see that the volume is right about almost 3, which is a very dangerous level, can lead to death. Even at 4 is hypovolemia. Now, if the person is taking too much water, then it will only be enough at about 5 liters. Any excess will end up being urinated. So you can be 4 or 5 liters inside, but it will end up in water diuresis, or it will be secreted by the kidneys, right? Huh? Now, it's also true that there is water intoxication. When there's too much water, you will end up having a positive fluid balance, and you will end up having hypotonicity. And when there's too much water in the plasma, for example, then it will tend to, again, where there's more water, it goes to the less water, goes to the less area of water, and therefore the cells, which has normal fluid in them, will end up looking like they have less. And the water in the extracellular fluid will tend to go inside the cells. And this will end up swelling up the cell and even destroying it. So it can be also dangerous and leads to uh, very disruptive and disorganized situation. Pulmonary and cerebral edema can happen, and when in severe state, this can lead to death. Now, there's also fluid kept somewhere in the body. We call it fluid sequestration. When fluid occurs outside of the circulatory system, it is unaccounted for, and we call it sequestration, hiding. The most common form of fluid being outside the circulatory system is when it goes into the tissues. You know, the blood vessels are among the tissues, and if there is a point where the fluid moved out from the blood vessel into the tissue and was not able to be pulled back in, then it becomes edema, which is the most common form of this fluid sequestration. And it will end up swelling the tissues. Of course, it will not be good because edema makes the function of that tissue not happening. At the same time, it can also lead to necrosis. Okay? Hemorrhage or bleeding is another cause of fluid that is unaccounted for because it's outside of the blood vessels. So either it's a hemorrhage that is seen right away and can be acted upon, or it could be an internal hemorrhage, which is hard to detect or see where it's coming from. Sometimes an individual who's passing out dark, hairy stools may actually be having bleeding in the intestinal area, maybe mild to moderate. In fact, if you check the level of blood in that individual, you might end up having to transfuse blood, right, in order to make sure that we don't lose red blood cell volume. Fluid in the thoracic area is also unaccounted because it's out of the circulatory system, and this can also be hampering your breathing. Right? In fact, sometimes it can even be a source of focus for lung infection. All right, good. We'll take a quick break before we move on to another balance. So we'll be right back. So and let you absorb that, so we don't confuse the two balances. All right, we'll take a quick break at this point.